Of all the Medicare decisions you will make, this one matters the most: Original Medicare or Medicare Advantage. Millions of Americans choose between these two paths every single year, and a significant number of them choose the wrong one for their situation, not because they were not smart enough to figure it out, but because nobody took the time to explain the real difference honestly without trying to sell them something. That is exactly what we are going to do today. I am going to give you a clear, honest comparison of both options, walk you through the important changes happening in 2026 that most people do not know about yet, and give you 5 practical questions to help you figure out which path is actually right for you. Let's get into it. Original Medicare is the traditional government run program. It has 2 main parts. Part A covers hospital care, and for most people, it is free. Part B covers medical care, doctor visits, outpatient services, and preventive care. The standard 2026 premium is $202.90 per month. Together, Part A and Part B cover about 80% of your approved medical costs. You pay the remaining 20%. And here is the critical thing to understand about Original Medicare on its own: there is no annual out of pocket cap. If you have a serious illness or a major surgery, your 20% share could add up to thousands or tens of thousands of dollars. This is why most people with Original Medicare also add a Medigap supplemental policy. Medigap is private insurance that fills in the gaps Original Medicare leaves behind, covering some or all of your out of pocket costs depending on the plan. Medigap plans do not include prescription drug coverage, so most people add a standalone Part D plan as well. The total monthly cost for Original Medicare plus a solid Medigap plan plus Part D can range from around $250 to over $400 per month, depending on your age, location, and health history. But what you get in return is coverage that works almost everywhere. Any doctor who accepts Medicare in the country will see you. No network, no referrals required, no prior authorization for most services. For people who travel, who have complex medical needs, or who simply want maximum flexibility, this freedom is often worth the higher monthly cost. Medicare Advantage, also called Part C, is a different approach. Instead of receiving your Medicare benefits directly from the government, you receive them through a private insurance company that contracts with Medicare. That insurer must cover everything Original Medicare covers, but they can also add extra benefits, and they often do. In 2026, many Medicare Advantage plans include dental coverage, vision care, hearing benefits, gym memberships, and over-the-counter allowances for things like vitamins and cold medicine. And here is the number that gets the most attention. Many Medicare Advantage plans have $0 monthly premiums beyond what you already pay for Part B. You still pay your $202.90 Part B premium. But on top of that, many plans charge nothing extra. Medicare Advantage plans also have an annual out-of-pocket maximum. In 2026, that cap is $9,250 for in-network services. Once you hit that limit, the plan pays 100% of covered costs for the rest of the year. This is a significant protection that Original Medicare does not provide. So why doesn't everyone just choose Medicare Advantage? Because it comes with trade-offs, and those trade-offs matter. Mershing, before we get to the comparison, there are some important changes happening in 2026 that you need to understand. First, there are significantly fewer $0 premium plans available in 2026. There are 231 fewer zero premium Medicare Advantage plans this year compared to 2025, a reduction of nearly 10%. Many plans that previously had no extra premium now charge one. This means the assumption that Medicare Advantage is always the cheaper option is less reliable in 2026 than it used to be. Second, supplemental benefits are being scaled back. Dental, vision, hearing, and over-the-counter allowances. The extra benefits that made Medicare Advantage so attractive have declined meaningfully across plans in 2026. Not everywhere and not completely, but the era of extremely generous extras appears to be moderating. Third, and this is positive news, the prescription drug out of pocket cap is now $2,100 per year, up slightly from last year, but still a significant protection for retirees on expensive medications. These changes do not mean Medicare Advantage is a bad choice, but they do mean that the comparison between the two options has shifted in ways that make it worth taking a fresh look, even if you have been on a Medicare Advantage plan for years. Let me put this together in a clear comparison. On cost, original Medicare gives you predictable monthly costs, but no cap on what you can owe if you get seriously ill. Medicare Advantage often has lower monthly premiums, but comes with an out-of-pocket maximum that limits your worst-case scenario. If you add Medigap to original Medicare, your monthly costs are higher, but your out-of-pocket risk is dramatically lower. On flexibility, original Medicare lets you see any provider in the country who accepts Medicare. Medicare Advantage typically limits you to a network. HMO plans require you to see in-network providers and usually need a referral to see a specialist. PPO plans allow out-of-network care, but at a higher cost. If you have doctors you love and want to keep, check whether they are in the Advantage Plans network before enrolling. If they are not, you may end up paying significantly more to see them. On extra benefits, in previous years, Medicare Advantage had a clear edge here with dental, vision, and hearing coverage. In 2026, those benefits still exist in many plans, but they have been reduced in scope and value compared to prior years. Original Medicare does not cover routine dental, vision, or hearing. On prescription drugs, Original Medicare requires a separate Part D plan. Most Medicare Advantage plans include drug coverage, but the formulary, the list of covered drugs, can change year to year. If you take specific medications, verify they are covered before choosing a plan. Now, let me give you 5 practical questions that will help you decide. Question 1. Do my current doctors accept this plan? If you are considering Medicare Advantage, look up whether your primary care doctor, your specialists, and your preferred hospitals are in the plan's network. If they are not, the savings may not be worth the disruption. Question 2. How is my health today? If you are generally healthy and do not need frequent medical care, a Medicare Advantage plan with a $0 premium can be a very cost-effective choice. If you have chronic conditions, see multiple specialists regularly, or anticipate significant healthcare needs. Original Medicare with Medigap often provides more flexibility and more predictable costs. Question 3. Do I travel or spend time in multiple states? Original Medicare works nationwide. Medicare Advantage plans are local. If you spend winters in Florida and summers in Maine, an HMO type Advantage plan may not cover you adequately outside your home service area. Question 4. Can I afford Medigap if I choose Original Medicare? Here is a reality that many people overlook. Original Medicare on its own, without Medigap, exposes you to potentially unlimited out-of-pocket costs. If you cannot comfortably afford a Medigap supplement, a Medicare Advantage plan with an out-of-pocket cap may actually provide better financial protection, even with its network restrictions. Question 5. Am I willing to review my plan every year? Medicare Advantage plans can change their premiums, networks, drug formularies, and extra benefits every single year. Original Medicare is more stable year to year. If you choose Medicare Advantage, You need to review your plan carefully every fall during open enrollment from October 15th to December 7th. If you are not willing or able to do that review, Original Medicare may give you more peace of mind. Let me bring this together. Original Medicare plus Medigap is likely the better choice if you want maximum provider flexibility and travel frequently. You have complex medical needs or see multiple specialists. You can afford the higher monthly premiums. You want coverage that is stable and predictable year over year. Medicare Advantage is likely the better choice if your doctors are in the plan's network. You want lower monthly premiums and are generally healthy. You want dental, vision, or hearing coverage in one plan. You are comfortable reviewing your plan each year during open enrollment. There is no universally right answer. The best plan is the one that matches your health, your budget, your doctors, and your lifestyle. Use the Medicare Plan Finder at medicare.gov to compare specific plans available in your area. And if you want personalized guidance, consider speaking with an independent Medicare broker, someone who represents multiple carriers and can show you your options at no cost to you. Whatever you choose, just make sure you choose deliberately. The biggest mistake retirees make with Medicare is not making an active decision at all. They drift into whatever seems easiest or whatever a neighbor recommended without comparing their specific options. You have done the right thing by learning about this. That puts you ahead of most people. If this video helped you, please share it with someone who is approaching Medicare decisions. They need this. Subscribe if you haven't already, and I will see you in the next video. Stay safe and stay protected.